The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
High cholesterol, high blood pressure, they can both contribute to fatal heart disease. Are ethnic groups affected differently by this disease, especially Hispanic Americans? Millions of African Americans live with diabetes every day. Sure, they're at higher risk, but why? And what is being done to educate? Certain medical conditions for women require hormonal treatments, but not all work. Can a process called compounding help? And who's behind such a tailored regimen? Seniors are becoming more proactive in their own health care, and through events like the National Senior Games, they certainly practice what they preach. We all can benefit from better balance, but how exactly can our mobility be improved? And to help eliminate the spread of infection in hospitals and restaurants, some companies have developed an interesting disinfection strategy. All these topics are next on Today's Health. This program is brought to you in part by Pfizer U.S. Pharmaceuticals, Women's International Pharmacy, Fitter International, and CyberCleanse.
A person's health profile is as individual as the person themselves. Everyone is different, and the combination of health challenges they face are uniquely theirs. Hello, I'm Faith Daniels, and this is Today's Health. Sometimes you can be at risk for a disease simply by virtue of who you are. For instance, people with Hispanic origins can be at a greater risk for high cholesterol. Understanding the dangers of high cholesterol and how it can be controlled is the key to avoiding the serious and too often deadly consequences.
The United States has always been noted for giving people an equal opportunity to achieve the American dream. Unfortunately, some illnesses are not equal opportunity diseases and strike different ethnic groups at a higher rate than others.
Recent health surveys have shown that the U.S. Hispanic population can be at high risk for several serious diseases, including high cholesterol, diabetes, and high blood pressure.
The key thing to remember is for Hispanics, heart disease is the #1 killer. Because of that, we have to be very concerned about our cholesterol levels.
When cholesterol is in the blood at a level, due to our lifestyle and our genetics, at a level that is really above what we were meant to have, a lot of that has to do with lifestyle choices that we make in terms of being very sedentary, not doing a whole lot of exercise, eating the wrong kinds of foods that are full of fats.
I learned about the cholesterol by my doctors, my nutritionists. He tell me how bad it is to have high cholesterol and how the cholesterol damage your arteries and your heart.
High cholesterol is a silent disease, which means that people with high cholesterol often feel fine until it is too late. Having your cholesterol checked regularly and learning what to do to avoid diseases caused by high cholesterol is a smart idea.
Everybody needs to know what their cholesterol level is, and a high cholesterol is a total cholesterol over 200. If it's over 200, no matter your age, consult your doctor.
Health professionals, associations like the American Heart Association, the National Coalition of Hispanic Health and Human Services Organizations, or COSMO, and educational materials like the Pfizer Guide to Healthy Living can be excellent sources of information about cholesterol. Multi-ethnic healthcare websites like closingthegap.com or cosmo.org can also give tips and guidance.
It's critical to involve the whole family in whatever treatment you give that Hispanic patient.
My family helped me a lot, encouraged me to do the exercise, encouraged me in my diet, to keep my diet, and my family used to do a lot for me.
People in the Hispanic population and every other ethnic group need to take the necessary steps to control cholesterol so that they might live a little healthier and possibly a whole lot longer.
It's a life-threatening disease with potentially serious complications. For African Americans, it's of critical importance: diabetes, Identifying it and understanding how to manage it is becoming a norm among the African American population. Are you at high risk? Individualized prescriptions, unique solutions. For women needing hormonal treatments, a specific pharmacy may be just what the doctor ordered. These topics next.
Blindness, kidney failure, and heart attacks can all result from diabetes. Yet it's a silent disease, which means you might not even know you have it. Everyone, though, needs to be aware of this serious condition, especially African Americans who are at higher risk for this devastating illness.
There are many things you can do to lower your risk for disease. However, many factors are uncontrollable. Your race, ethnic origin, and heredity are all things you can do nothing about, but they can affect your risk for deadly diseases. This is especially true in the African American population, which has higher rates of diabetes, heart disease, cancer, AIDS, and some other serious illnesses than the general population. In the case of diabetes, it's estimated that there are 2.3 million African Americans with the disease.
We're not certain why African Americans are at higher risk, but they certainly are at higher risk. Diabetes, particularly type 2 diabetes, has a familial relationship. That is, it is inherited. The complication of diabetes primarily is related to vision loss, as well as nephropathy, disease of the kidneys, which frequently results in kidney failure, and inflammation of the nerves, primarily of the lower extremities, the legs, the feet.
Diabetes can lead to blindness, renal failure, and heart disease. To find out about diabetes, how you can identify it, avoid it, or manage it, there are some excellent resources. Most importantly, speak to your healthcare professional. Also look to associations like the National Medical Association and the American Diabetes Association, and informational resources like the Ebony National Medical Association Guide to Healthy Living video and guidebook, sponsored by Pfizer. Some internet websites can also be a good source of information and guidance, as long as you are sure the source is a credible one.
The diet that's recommended to help keep blood sugars lower is primarily what we call the American Diabetic Association diet. It is a diet that recommends low carbohydrates, low sugars, and it is a cornerstone of treating diabetes mellitus. This is a very serious disease, and the emphasis should be on early detection and early treatment of the disease, certainly long before symptoms have occurred.
Fatigue, frequent urination, constant thirst, and vision problems are all warning signs of diabetes. If you have a family history of this disease or any questions about diabetes, ask your doctor. It could save your life.
There's a popular book called Men Are From Mars and Women Are From Venus. The title simply states the obvious. Men and women are different, and they have different needs. It's also true when it comes to health. And some new ideas that cater to the specific genders may help serve their needs even better.
It's common knowledge that every human being has different and individual emotional needs. It may be less well known that our biochemical needs are also unique. For women, premenstrual syndrome, or PMS, menopause, and infertility are just a few of the challenges that can require individual and specific hormonal treatments. Hormonal replacements for men can be indicated in cases of andropause, or male menopause, adrenal and pituitary support, and other hormone-related conditions.
We supplement a woman with estrogen, progesterone, and testosterone. Now, women don't make as much testosterone as men do, but they still need a little bit to keep them feeling good.
When I went to see my nurse practitioner, I was having problems. I was having night sweats. I was having lack of concentration, hot flashes, wasn't sleeping well at night. And so she suggested hormone replacement therapy. They tried everything on me, and no matter what they used, nothing worked.
Rebecca, I'm going to write you a prescription for the Women's International Pharmacy.
Many patients are partnering with their healthcare providers to develop individually customized solutions that supplement their specific hormone levels. This requires a pharmacy, like the Women's International Pharmacy, to create or compound these individualized prescriptions on a patient-by-patient basis. Informational resources like the Women's Health Connection help disseminate the information to facilitate this process.
Compounding hormone replacement for women is an excellent alternative for them. That way they can have what they truly need and not what some pharmaceutical company feels they should have.
Most of the prescriptions that we compound for physicians come for either infertility, PMS, menopause, postpartum depression, adrenal and thyroid support. A tremendous amount of the prescriptions are actually prepared with the doctor and the pharmacist having a consultation, and with a lot of input from us as to exactly how that should be formulated.
Hi, this is Rebecca Lehman, and I'd like to call and get my prescription refilled. The pharmacy has been great. They'll answer any question that I ever have, and I can't say enough about them. As far as how I feel, my symptoms are much alleviated. I'm sleeping better. That is a big part of it for me. I don't have any of the other symptoms. I don't have the night sweats. I don't have the hot flashes. And I just, in general, feel better.
It's something we learn as a child and often have to practice to preserve. Balance. We often take it for granted until a serious fall jeopardizes our mobility. What's being done to increase stability on our feet? In hospitals and other institutions, a unique disinfection program is now available that could potentially save lives. Stay tuned for both these topics.
Good health begins at home. It's especially important for the aging baby boomers who are now approaching 50 and beyond. If this huge segment of the population can adapt their lives to include home health and wellness, then their retirement years may be the healthiest ones yet.
You may have heard references to the circle of life or the balance of nature, but balance isn't simply a concept for the environment. Balance can also be very important for stability, agility, and mobility.
The Journal of the American Geriatric Society reports that 1/3 of people over the age of 65 become unbalanced and fall at least once a year. 1 in 20 of these falls leaves them with injuries like broken hips, wrists, or arms that never mend properly and often leave them incapacitated. But balance is not just a challenge for the elderly. Professional athletes, people recovering from injuries, and anyone with postural problems can all benefit from better balance.
The term balance refers to the ability of a person to prevent a fall under a lot of different situations.
Better balance can improve performance for an athlete, and in the elderly it becomes even more critical. It can increase their mobility and help preserve their independence for a longer period of time.
I think this training has helped because I know that I can actually think better after I go through a workout. It does not make me tired. In fact, I think I'm more alert with all the exercise that I do.
Many people, young and old, are becoming aware of the benefits of balance training and how it can help increase the quality of life and reduce the risk of falls and injuries. Balance-specific equipment like this wobble board and other balance aids developed by Fitter International can often help increase a person's mobility by improving their agility and balance.
There are a number of studies that have shown that you can improve your balance with exercise. So it isn't necessary for people to say, well, my balance is worse because I'm getting older, or I have to learn to live with it. You can improve your balance regardless of your age.
There's lots of benefits for balance training. Emotional benefits are incredible. Confidence to try anything you want to try if you just do a little bit of balance training. You have a disease, the confidence to look within and to find the best cure that you can find for yourself.
How balanced are you? Think SAM. Stability, agility, and mobility training are no longer just for ballet dancers and gymnasts. They may be able to improve anyone's ability in sports and everyday movement, and that can result in better performance, self-confidence, and safety.
May sound like a contradiction, but one of the most dangerous places in the world can be a hospital. Infections acquired in the hospital account for nearly 100,000 deaths every year. Hospitals are responding to the crisis by searching for more effective solutions for disinfection.
going to a hospital could be harmful to your health. This statement may be hard to believe, but it's true. The CDC estimates that 2.4 million hospital patients in the U.S. contract an infection during their stay after being admitted for something else. Of these 2.4 million cases of hospital-acquired infections, about 100,000 will prove fatal.
When people are admitted to hospitals, they're admitted to try and be made well. The problem is that while they're there, they are being exposed to a number of organisms, yeasts, germs.
One of the most common forms of germ transmission is from the hands of a doctor, nurse, or another staff member. Hospitals are not alone when it comes to spreading infection. The food service and hospitality industries can also be a transmission source that enables a virus or bacteria to pass from one person to another.
Many of the strategies that are utilized to promote an environment that decreases the chances for infection circle completely around the idea of washing and good cleanliness.
Many institutions are looking for safer and more effective disinfection solutions that go beyond mere soap and water. Hand-washing innovations, like the CyberCleanse system, may provide an important part of a more effective disinfection program. In this system, an infrared sensor identifies the hand's presence and dispenses a portion of the cyber gel that can destroy up to 99% of germs. The cleaning solution is absorbed into the skin, so there is no need for towels or water.
In disinfection control, making it easy to use means it's going to be used. And that way, the public knows that in the hospital, in the restaurant, on the airplane, the people who are taking care of them are doing their job to promote an environment that has a diminished chance of infection.
In addition to being a constant threat for infections, today's bacteria and viruses are becoming increasingly resistant to traditional medications and antibiotics. This alarming fact emphasizes the importance of having an effective disinfection strategy that can stop harmful germs before they become deadly.
There's so much to learn about all the topics we explore in this program, but with only 30 minutes, it's difficult to cover everything. If you'd like more information, log on to our website at vstar.com. You'll find facts, details, audio, video, and cross-links to sites for every topic we discuss. Baby boomers is the name given to those of us who were born between 1946 and 1964. Well, the boomers are getting grayer, and as this large portion of the population moves past their 50th birthdays, they are making many changes to improve their lives and redefine what it means to grow older.
It's a simple fact. Americans are getting older. The sweet-faced cherubs of the post-war population explosion known as the baby boom have grown up. This generation has changed the world in many ways, from social reform to high technology. And as they approach retirement years, they're still making big changes.
Getting older is getting better and more common. In 1995, the number of people over 65 was about 34 million. By the year 2030, this number will more than double to about 70 million, or about 20% of the population. Even though advancing age increases the risk for many diseases and ailments, today's senior population is taking an increasingly more active role in staying healthy and improving the quality of life.
As we age, our immune systems change. We're less capable of fighting certain infections. As a matter of fact, flu and pneumonia, which are very common, are the leading cause of death due to infection in the elderly.
At the age of 72, I feel that I have as much vim and vigor and vitality as I did 20, 30 years ago. The steps that I'm taking right now is I stay on a very, very strict diet, and I do a lot of exercise. I do a lot of walking, and I work out on my Health Rider machine. And I also do a lot of stretching.
I feel that's very important.
The awareness and interest in the needs of the senior population have prompted an enormous variety of educational and informational resources. Also, associations like the National Council on Aging and websites like agingworld.com can help educate and empower seniors to take an active role in their own health care and quality of life.
I have applied to a number of health magazines, and I'm reading a lot of health books. And when I see something that applies to me personally, I bring these questions up to my doctors, and I try to find out exactly where I fit in.
I think that the information that seniors are seeking out to understand disease prevention and illness is in fact helping them to live healthier lives. Not necessarily always longer lives, but the years that they have are of better quality frequently.
I don't feel like I'm aging in any way whatsoever. I feel like I'm 40, 50 years old or even less, and it makes me feel great.
Just because you turn 50 doesn't mean you have to slow down. Today, people who have already turned the big 50 are staying active and competitive in many athletic events. The National Senior Games proves that today's seniors are in a league of their own.
Ponce de Leon never found the fountain of youth, and modern medicine has no cure for aging, but there are some key things you can do to battle the aging process and help keep age-related diseases at bay.
Eating a low-fat diet and maintaining a routine of regular exercise can help reduce stress, reduce cholesterol, and may prevent hypertension and other cardiovascular diseases. An excellent example of some seniors working to stay in top physical condition can be found at the National Senior Games, sponsored in part by Pfizer.
The National Senior Games Association is comprised of 50 state members. We're in every state in the nation except Alaska, but we're in the District of Columbia. We have a lot of athletes here today that are setting world records, some of whom never competed until they were 50 or 60 years old.
Athletic events like the National Senior Games can showcase the talents of some great athletes who are over 50. But more importantly, they send a message to seniors and people of all ages and help inspire them to stay healthy and get the most out of their lives.
Good health would mean strength too, and I think strength is the main thing you need when you're shooting archery.
There are too many couch potatoes today. They have a little ache here and a little ache there, and oh my gosh, I can't do this. And you know, you just have to overlook the little aches and pains and just get out there and train.
You don't have to be an athlete. Anyone in shape and with any bad habits can adjust their lifestyle and help themselves live better and healthier in their senior years.
The bottom line message is healthy lifestyles for seniors. It's never too late to exercise. It's never too late to have proper diet.
Winning medals is not the most important thing. It's the camaraderie of competing with your fellow athletes.
The explosive growth of the U.S. senior population will have an enormous impact on the way we look upon aging and society's treatment of the elderly. Hopefully we can begin an age of enlightenment where growing older in America can be a healthier, happier experience.
If you're one of the lucky ones who happens to be in good health, be thankful and take the necessary steps to maintain it. But if you happen to be facing health challenges at the moment, keep fighting and have hope. There are new and better solutions coming along every day. I'm Faith Daniels. For more information about any topic we covered on this program, log on to our website at vstar.com. And join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.